You're doing
Yes.
house calls, kind of telling the folks here what it is like from another person, what that is.
Definitely.
Mm-hmm.
When I listen to your stories, I can definitely relate about the experience. A day in the life for me is more so, ours is more like preventative care. We don't do much treatment.
Mm-hmm.
But I do find in my role, there's a lot of like case management.
Mm-hmm.
And I don't know if you have that same experience, but pretty much a lot of phone calls, referrals.
Mm-hmm.
And sometimes the conditions are so disheartening. And I find myself having to like debrief a lot of times after leaving,
Mm-hmm.
just trying to get myself together. But pretty much I see like on average, for my 10-hour days, I see about like 7 to 8 people a day.
Mm-hmm.
Because the territories are kind of far apart. I don't know how it is for you
Mm-hmm.
in your experience, if they kind of like keep everyone together. But for ours, it's more so like wherever the needs are. So we travel a lot. Sometimes I can drive 2.5 hours to 3 hours a day.
In total to see the 7 patients that you have, or?
Yes.
Okay. Mm-hmm.
So, but overall, I do feel like it's really impactful, and I do enjoy it. But I do feel it's a bit. It's hard. It's one of those roles where you want to do more and
Mm-hmm.
you just can't.
That's so true. Yeah.
Yes.
That is so true. Yeah, with my company, so I have the option of, booking my own patients. So I take up that opportunity, because when I do that, I feel as though I am not wasting too much time on the road, in terms of the wear and tear on my vehicle, because I tend to group them
Gotcha.
in one, like in one zone. So, for example, I'm going into Dallas. I try to see the patients in that area on one day.
Okay.
So even though it might take me probably like say 3-4 hours to see everyone,
Yeah.
the drive time in between sometimes are a little bit like, say, 10 minutes, 15 minutes. And so unlike
okay.
if sometimes the company do go ahead and book the patients, the drive time can be between 30-45 minutes sometimes, because of where the needs are. So yeah.
Gotcha.
And then today I went in, as I say about the whole experience. When I went in today, it was more of, I had a patient who, hi Bernard, thank you for tuning in, and Denzel. I had a patient who this is the first time I was meeting him in person, because last month when I saw him, he never wanted an in-person visit. And so I said, all right, you know what? I'm going to try and see him today. And when I went in, it was the same situation, the living condition was just like, sad. It was an apartment. I walked in and everything was all over. When you talk about lunch boxes for days, and then he has a wife who, not a wife, a sister who was in rehab, and she is, immobile as well. So you have two persons living in a home, just sitting, eating, putting things right beside, and you just have like shelves of, quote unquote garbage all over. And then not to mention, there were like roaches running around. And I'm like, oh my word, how can persons be living in this kind of situation? So it is very sad a lot of days, just by the population and what we are having to deal with. Okay.
100%.
Okay. So in terms of, your day, how do you normally, in terms of coping? I know you say you do a lot of debriefing. What kind of, how do you handle your stress levels, throughout the week or the day, working as a nurse practitioner or as a nurse?
I would mostly say my faith.
Mm-hmm.
It definitely helps me to like just renew my mind every day, and honestly has put me in a position of gratitude where like I could have a rough day, but I find the goodness in so many things.
Exactly.
And I think that's what House Calls has done. It has humbled me so much.
Mm-hmm.
And yeah, and I try not to take it personal.
Mm-hmm.
But sometimes it takes a couple hours not to take it personal, because it's difficult. It's definitely difficult, but
Yeah. Mm-hmm.
yeah, I just try to stay grateful.
That's so true.
Helps.
Yeah. Because a lot of times I go in, sometimes in as much as you probably want the patients to be doing this and they're not
Yes.
able to do it, and then it's like you're educating them, but then they're getting
Yes.
upset, upset at
Exactly.
you. You just have to kind of, understand from their
Yes.
perspective, what's happening. So it's very important that, you just have to think, as if you're in the patient's shoe at all times and just understand them. So forgive them at times
Yes.
whenever they get upset about certain things.
Exactly. And oftentimes, like sometimes I have patients who are really resistant when I come in, even to the point where I have to ask myself, like, am I safe here? And just being just being compassionate. At the end, a lot of the times they apologize.
Yeah.
And that's like really trying to stay objective, not take things personal, and don't treat people how they're treating you, because you don't really realize the full scope of what's causing their behavior.
Yeah, that's so true. And then the other thing I realize sometimes with a few of them, I don't know if you've encountered, if it's a case where they've had, previous experience with other providers or persons coming into their home, and not saying that they're judging them, but in terms of the treatment, it's probably a little bit different. Sometimes you'll hear they talk about how persons speak to them. So I think with that as well, they kind of give you a standoffish kind of behavior, or sometimes they're just like a little rude, disrespectful towards. So, but after you get to know them, interacting with them, you really see a different side to them, because sometimes they just need somebody to listen to them.
Of course.
That's it. They just want somebody to sit down and talk with and just listen to them. So, yeah.
That's it. Can I ask a question about something I often encounter, and I'm still figuring out how to deal with it?
Okay.
Sometimes I have patients where I have identified, like, for example, a diagnosis that is considered somewhat sensitive, and I'm trying to educate them, but it can become triggering. Like, for example, one thing that we have to address, I don't know about your role, is like the alcohol use. And you will address it, and sometimes in their home you realize that you're stepping on toes, but then you're kind of like wondering, should I leave it alone? Another one I had the other day was heart failure. I assessed the patient, and all the clinical symptoms said heart failure, the medication said heart failure, and when I mentioned it, they got so livid. So I find myself in the situation like, is it safe for me to go ahead and have these conversations in the home? You know what I'm saying?
Yeah, I totally understand. Especially the alcohol use and the drug abuse questions in general. When you talk about them, they tend to get a little bit offensive. But one thing I always do is try to just look for the exit. Try to look for the exit, make sure I know where to run. But I try to still, try my best to bring across the information as best as possible, that's all I can do. Try to just bring across the information as best as possible, educating them and not letting them feel as though I'm judging them, that kind of way. Because some persons, you might be educating them and they take it the wrong way. So I try to just explain it to them and try to link it back to what their condition is, make that correlation with both things, so they can understand from our perspective why we're discussing certain things.
Thank you.
All right, no problem. So let me hear about your CRNA. Let's jump into that part if you don't mind. How is that going? Well, hold on.